podcast. Welcome to the Wild Widow
Thank
Woman
you.
podcast. We are brand new to the
Yeah.
interwebs and super excited to be able to reach out and help widows globally. My life's work has 9 years past, after my husband has passed, has led me
Mm.
to holding the hands of widows around the world so that, we can move forward.
Yeah. Yeah.
I've my I don't know if you've gotten a chance to listen to any of my episodes, but my story's in the first one. It's strictly audio because I didn't know how to do the video thing.
Right.
But
I hear
I'm
you.
still so new to this. But so I'm Rachel Kruger. I'm 9 years without my hubs in March, and welcome. So tell me
Thank
just
you.
a tiny bit about you. First of all, I am so very honored that you
Uh,
accepted the invitation. I'm so blessed, and um, I've followed you for a while. I don't know if our listeners know who you are. You're the fight doctress on Instagram, a ringside doctor, also a widow of different circumstances, and kind of that's why you're here. So tell me just a tiny bit about you.
um, about me or about how I became a widow? Where do you want me to start?
Just about you in your own words, kind of, what's going on with you right now. I've got questions over here, so if
um,
you see me looking, that's why.
yeah. Oh, so yeah, right now, so I was widowed in 2016. My late husband was a retired MMA and Muay Thai fighter who had CTE and killed himself. And it was a pretty dramatic, kind of almost something would have come from that movie Concussion. When I saw that movie after the fact, I couldn't really, it was a little bit hard to watch. So he kind of came at me and then killed himself. Prior to his death, I had worked as a ringside physician a couple times because I've been training Muay Thai like at that point, I think 10 years or 12 years. And so I just helped people out, but I wasn't super skilled at it, and then through a series of kind of mental health challenges as far as trying to get back on track after suicide, and with the help of the fight community and a boxing coach, they all kind of pushed me to become a ringside doctor again. I couldn't really handle seeing fights after he died for a while. So when I got back to it, they kind of said, who's better to help take care of us than you? Like, what you're talking about.
Right.
And it took a lot of work to be able to, sorry, I have a dog here, to be able to emotionally do it. But then I studied and studied, and I've just kind of done more and more and more with it. I'm on the board of the Association of Ringside Physicians now. I
Yeah.
have a couple publications coming out. I've worked with pretty much everybody from the UFC to the PFL to even one championship. So yeah. Yeah, I feel like it was kind of a mission to help
Yeah.
you know hopefully keep others from going through what I did, or at least decrease the chances of that happening. So
Absolutely.
that's kind of what I do. I'm a mom. I have a medical practice also, and the ringside work is more like a weekend job.
Yeah.
Yeah, that's me. I just finished writing a book last year. My editor's working on it to tell my whole memoir. So that's been my big project. I hope to have it published by the end of this year if my editor gets moving. Um, yeah, that's
That's
my story.
exciting. That's exciting. That's so cool. So, I was going to ask you what inspired you, but that's super cool that you were the fight community kind of ushered you in and it was healing for you. I like hearing that. I like that you had a community. That's kind of been well, it's 100% been where I found myself, widows in general without community, and
Mhm.
healing is really hard to do when you don't have that. And your circumstances is different obviously in so many ways. Um, so how do you juggle being a doctor, an advocate? I know you're a mom, you got fur babies, I mean, how do you manage all of that? And I guess and keep your head on straight with grief.
Mhm, mhm. So I'm a very goal-oriented person, and I also am a person who likes to solve problems. So when he died, I really tackled treatment early and aggressively. And so, like, I I was in therapy the week that he died, and I went multiple times a week. And within a month, I went away to a place in Arizona where I did intensive trauma therapy. And, and I just had things like that scheduled along the way. I didn't waste any time
Wow.
because one, it helps me mentally feel better to plan, but the other was that the pain was so bad, I couldn't imagine living with that kind of pain for a long period of time. And so maybe I was a little desperate to not
Sure.
feel that way anymore, but it turned into, very aggressive therapies. I did a type of trauma therapy that helped a whole lot. And, and then, I mean, it still took several years, obviously, but I was able to function, and within about 6 months, I think I was able to function like a normal human being. I mean, there were still setbacks,
Gotcha.
obviously, anniversary dates, things like that.
Yeah.
But doing trauma therapy early, I think, really helped. There are several different forms of trauma therapy out there, but I think that like that, the shock was the worst part of what I went through, I think.
Yeah, absolutely. So, that being said, can you, as much as you're comfortable, obviously, I don't want to overstep, but can you how can you share a little bit more about your husband's passing, how it impacted you, and then the navigating grief, obviously, with
Mhm.
the trauma therapy? How has this experience? How has that I just said that experience shaped your overall perspective on love and life and resilience? And I mean, because my experience, I think all widows, the impact of losing our spouse, our partner, regardless of how that happens. One of my podcasts, there's a Venn diagram
Mhm.
that's got, the center is the primary loss, and then there's, 6 or 8 on, and it just gets bigger and bigger. And I
Right.
found that it impacts areas of our lives that we didn't even realize, our identity, our self-confidence, um,
Yeah.
our purpose in life, things like that. I mean, my dreams for the future, it's like, what dreams? I dreamt with my husband, now what, So, all of that to say, is losing him, navigating grief. How did that shape where you are now as far as your perspective on love, life, and then the resilience that you have found, obviously, to move forward?
So I think that when I read a lot of books after he died too, and I read a lot of books that said you'll never be the same again. And initially, I kind of grieved that too. I grieved so much of myself that I lost because of him dying, um, and I thought I don't want to be a different person. I was pretty happy with who I was, and I had a pretty good life until that happened. But now that time has passed, I can see that definitely it changed me.
Mm,
And in some ways it was almost like you have several lives in your life, right? So many
I believe that too.
lifetimes.
Yeah. Yeah.
And I feel like since he died, it's a it's a whole new life.
Right.
It's a different life. And honestly, it's a better life than before he died. And at that time I thought there wasn't much else to have, but I just the gratitude that develops for my kids, the ability to slow down and do nothing. That's what shock did for me. Sometimes I say that shock was almost like if you rebooted a computer in my brain. And
Wow.
I was such a busy person. I was a workaholic. I probably worked 80 hours a week. I juggled a lot. I could never go to the beach and sit and do nothing.
Yeah.
I had to be busy, busy, busy on vacations. And I remember, let's see, he died in June. That October, I took a beach trip with my daughters. And it was the first time ever in my life that I sat on the beach and did nothing all day, every day, and just watched the
Wow.
waves and just watched my daughters playing. And I never in my life could have done that before. And so to me, that savoring life, that slowing down, um, being grateful for amazing things that are here, just with that real knowledge that it could all be gone in a heartbeat, I think those things changed about me and have made my life better, honestly.
Absolutely. Absolutely. I share that. I phrase it a little differently. What I tell people, and maybe it's a Southern thing, I wouldn't give or take. I wouldn't give or take for what I've got right now.
Yeah,
What I
yeah,
have right now is vastly, I mean, it's a whole different world, different than, I mean, I grew up, my kids rather, grew up in, white suburbia. I currently live in a 700 square foot apartment in the hood, and they got to learn what it was like to move to the city. They got to learn what it was like to, you know, put 2,600 square foot of shit into a tiny little box and, choose the things you want to come with you, and I mean, so it is a different life. I remember thinking that. I remember thinking that I felt like I'd been playing house, you know?
yeah.
And then all of a sudden,
All the things that you were supposed to do in life without thinking about what do I want to do for myself? What
right,
that like thinking the difference between self-care and selfishness and
right.
never doing self-care and realizing that you have no choice but to do that after the death, if you
Yeah, your
didn't, you
choices
wouldn't
become
survive.
so limited. It's like you're going to take care of yourself or you're going to sleep.
Yeah.
Those are
Yes.
your options.
Yeah. 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 Yeah.
Yeah. So, yours, I want to get into more of the differences. I mean, I know that I try really hard when I speak to other widows and anybody that's suffered traumatic loss, be it a child, a parent, whatever, sometimes my fur baby, whatever. Um,
Yeah, I
I try.
apologize for one, but she's got husky, and if I don't hold her,
Oh
she
no.
will
Oh,
talk
I see the
over.
husky. You do what needs to be done.
She will talk over the whole show.
No, I've got three cats here. One of them will probably be on me in here in a second anyway. So yeah. So what I try to do with most of the widows that I talk to and the other people that have lost is I try to dwell on the similarities because we find community in the similarities, I but your experience is so much different because of the self loss. It was he lost self in it, and the mental illness involved in it from his side. So what let's see, I'd like to understand CTE more, I guess is where I'm headed with that. I'd like to understand that and how it affects the athletes and just really I want to hone in on that, the suicide awareness, the misconceptions about suicide, all the things, and then of course how it impacts and how it impacted you specifically in your personal community of combat sports.
Gosh, that's a whole hour conversation right
Oh
there.
geez, okay.
um,
Sorry. That is
so,
a lot. That
so
is a lot. Yeah. Well, that's
yeah,
the hub.
so
That's where you live, is in the CTE.
yeah, it's that's it's I talk about it a lot, right? So
Right.
chronic traumatic encephalopathy is a progressive disease that is in part caused by hits to the head or shaking of the head, and you see it in a lot of sports like football. A lot of the research has been funded by the NFL lawsuit and is going on out of Boston University. So a lot of the research is more specifically towards American football,
Hmm.
but you can see it in soccer, you see it in combat sports. Um, and it can involve just a myriad of symptoms. Basically, when you have shaking of the head, you have tearing of tiny little blood vessels
Certainly.
that almost microscopic, and then you have laying down of these plaques, amyloid plaques that kind of disrupt the function of the brain. So for some people, they might just have progressive motor symptoms. If you think of Muhammad Ali and his end
Right.
years, how he had Parkinson's syndrome,
Hmm.
um, that can be a manifestation. Memory, impulse control, but then also fine motor skills, but then the mood disturbances, depression, anxiety, and an increased risk for suicide then. So all of that goes along with it. It's not just hits to the head that cause it. It seems like that some people participate in their sports and never have it, that there's probably a genetic issue. Recently, that research came out that I posted on my social media where they found a link to family mental health illness and risk for suicide with CTE. So there's more to it in how it manifests, but that's kind of the bottom line for me. initially when he died, I thought it was an excuse. Of course, I can't remember how long. I have to go back and look in my journals, but it was several months before Boston University, sat me down via phone calls and talked to me about everything. And so there was enough time that I just thought I was looking for excuses for the suicide, because everybody wants excuses. Everybody asks why when suicide happens, and the why can just be that someone has a mental health disease, And so um, I didn't want to attribute it all to that, and I didn't want to assume it was something just to give me an answer to the why, because I feel like so
Making
many
sense of it
people
all. Yeah.
so many people die by suicide, and the answer is they had a disease of the brain. It might not have been CTE, it might have been mental health, but that's a disease, and I don't want to take away that. It's like, oh, I have a reason for his suicide, and other people don't, because it all is a brain disease, right?
Right. Absolutely.
Um,
Absolutely.
so, but what I finally was convinced, because a few weeks before he died, he had some hits to the head, and he started with really bizarre behavior after that, but he didn't complain about headaches. And when one of the researchers at Boston University, one of the experts, said, when he was talking to me, yeah, CTE, and he said, did he have any hits to the head like about 3 weeks ago? And then I was like, how, I didn't tell you that. Yeah. And I said, why? And he said, because it just progressed so rapidly. It must have
Yeah.
been exacerbated by an acute concussion syndrome. And that's when I finally believed it.
Yeah.
So I focus on concussions too, because even with an acute concussion, you can have psychological symptoms. I have a lot of fighters who've reached out to me over the years who say after a bad concussion, they were depressed and suicidal for a year or two. So it isn't just CTE,
Correct. Yeah.
concussions can do that too. So my late husband, like in all likelihood, had a combination of the two.
What is
So,
the difference,
so
Andrea?
yeah,
What is the
yeah.
difference?
The difference between a concussion and CTE.
Yes, ma'am.
CTE involves changes like tiny little tears
Okay.
to
Gotcha.
the blood vessels, and then you have these specific plaques that are laid down. You can think of a concussion as kind of like a bruise to the brain that you can't see on imaging
Got it.
studies.
Okay.
So,
Got it. So not a
yeah.
huge, definitely a difference, but we we as lay people wouldn't even know the difference by looking on, it sounds like.
No, I mean, but even you can have one concussion and recover from it, and it's
Sure.
it's not a progressive disease like CTE is.
Okay, gotcha.
Um,
That is the difference. One is a disease and one is an
mhm,
incident, I guess.
mhm,
That's
mhm.
awesome. Okay,
Yeah,
that
like
helps
an
my brain.
injury.
That helps my little
Injury.
brain settle on it.
Yeah, yeah,
Um,
yeah.
so have you had the opportunity to get to, I mean, obviously you are an advocate and you travel the world, um, to speak on discussing suicide and CTE publicly. Have you gotten to reach out in ways about
I
that?
mean, I've had a variety of podcasts over the years,
Oh,
some
good.
reporter interviews at ESPN. I talk with the Association of Ringside Physicians a lot, and
Okay.
honestly, the fight community is a pretty small community. If you'd be
Really?
surprised,
Yeah, I
we
am
all
actually.
over the world, and so I'm friends with a lot of fighters, and so my story's kind of well known from what I put out on social
Sure.
media,
Yeah.
and sometimes when a fighter has someone in their family died by suicide, they reach out to me, or it's just it's a gossipy small community. So so people know my story,
Yeah,
right?
I think that's human nature too. We like to talk, you know.
Yeah, yeah. So um I'm just kind of known for that story. And
Yeah.
what the work that I do is with fighters before and after the fights and pre-fight physicals. And so sometimes the story comes up when I'm trying to talk to them about their recovery time
Okay.
afterwards. Once in
Okay.
a while, I bring my story up if I don't think that they know it already, to explain why it's so important for them to recover or something, if they had a bad time in the ring or cage. So it's mostly one-on-one. I mean, I have spoken with at the Association of Ringside Physicians about mental health in combat athletes, but not
Okay.
specifically CTE.
Oh, okay.
We have other people who lecture on that. So I mean, it's a variety of places and platforms that I talk about it, I guess.
Yeah. So, given that you dove into healing pretty quickly, that which is completely the opposite of me. I mean, I fought tooth and nail everything it meant to be a new widow for nigh on to 5 years. I mean, it's I've only been on my healing walk for about 3.5, 4 years now.
Wow.
Yeah, it's yeah. Um, Not something I'm proud of, but again, wouldn't give or take for
Right.
it.
I mean, we all have our own path, right?
Yeah. How because you did so much early work and so intensive, how or do you even find grief cropping in throughout the years, say on milestones or on events where you miss his presence, that kind of thing? How does that crop in, and what is your process when the grief does revisit, for lack of better verbiage?
Well, of course, the death anniversary day has always been hard, and that I feel physically, and I can feel it even going because it was June 13th. As it gets into May, it's kind of like you dread June coming. So I honestly, I tried to take a vacation around that time to distract myself. I try to change time zones, so I sometimes don't remember what day it is. Go to another part of the world so I lose track of when it's actually the 13th. That trick has helped for me a lot.
Oh wow,
Um,
that's cool.
um,
What a great idea. What a great
um,
idea.
so that's the biggest time that it hits, and then it hits with our daughter because she was 1.5 when he died. So, obviously every time you have to fill out one of those stupid forms where they ask if you are a widow, which why should you have to tell them that? Single is single, or when you have to write your emergency contact, all that stuff is hard.
Yeah.
And there's always a little twinge with all of that.
Yeah.
But with her, my daughter's 10 now, and so her questions change as she gets older. And
Sure.
so watching her process it brings a lot back to, how do I cope with it? So with the death anniversary, that's my trick, time zones.
I love
Um,
that. I love that. If I had that option, that's what I'd be doing. But I understand the creeping dread. I actually was reviewing my podcast yesterday as I was publishing. I got to interview a death doula, which was super cool. But I was publishing that and kind of reviewing the other episodes, and yeah, I the dread. It's like I lived in dread for like 4 or 5 years. I mean, every single day, it's like, how am I going to do tomorrow without him? I've never done January 15th, 2017 without him. I've never done, and it was like every single, I held on so tight to the loss part of it. It made it very difficult to move forward. So, but the dread, and I spoke about that. Um, Ours is March. Uh, he he passed March 15th, which is 4 days after my youngest daughter's birthday. They were 14 and 16 when he passed, and so she turned 14. 4 days later, he died, and or I had to take him off of life support, um, and that dread is something else, man.
yeah,
On holidays, I even felt it. I felt it like, or and sometimes still do. I mean, obviously, our wedding anniversary is a big one as well, but it's almost like January dawns, and I'm like, oh shit, March is coming, March is coming. What do I do?
yeah,
And so what I've done recently in the past year or so, is choosing to acknowledge the day and look at my life and what my life demands and commands of me today, and let those two things live side by side rather than just do one forsaking the other, which is what I'd been doing for years. I'm just gonna be a widow, nothing else. And I find, I love that you said single is single, but I got to tell you, it hurt my feelings a little bit. Like, here's she just kind of stepped on my identity right there, because and that's I have and to each his own, and everybody is different,
right,
but I think because of my driven purpose now, my identity is in widowhood.
right,
Your identity is your fight doctress. I am wild widow woman because I lost my damn mind for 4 or 5 years. So but I find that really comforting, that it doesn't have to be the same for all of us. You don't
yeah.
have to live in the identity of widowhood. That's so cool for you. I get to, and it's so cool for me. It's a different perspective, and
Right.
it's taken me, Jesus, every minute of 9 years to get here, every single minute. Um, so you wrote a book, it's your memoirs, and you're writing another one, you said?
No, I'm working on some publications
Some
in combat
publication.
sports.
Okay.
Yeah,
Okay.
yeah.
Okay. I'm excited about the memoirs, though, I gotta say. I gotta say,
The
it's gonna be
I'm excited about the book. I have a really good editor. He's just a little bit slow. So, everybody always asks me. I mean, it's a good story. It's a good story not just because of what I did, but for insight in the combat sports community and how they all came together. I could have a lot of people like my older daughter. He had been her coach, her Muay Thai coach for 12 years. He was her stepdad, but she called him daddy. Her biological father wasn't super involved in his life, and she has gone into a gym one time since he died, and that was just like 2 years ago. And she got rid of all her gloves. She refuses to make that a part of her life at all. And she was a beast of a fighter, honestly.
like a breaks my
Um,
heart.
yeah, and I mean, and so I think for some people, when that had happened, and initially, I was like blaming the sports, um, and that just compounded my grief because the combat sports community, we owned a Muay Thai gym. These were our friends. It was 70% of my life outside of work involved combat sports. So I felt like he took all that from me too. And so I think also because it's suicide, then, to me, I felt like he did this to me. I was the one who was traumatized, and I was taking my life back and saying, you're not going to do this. You're not going to take everything away from me. Because it's a different kind of death, right?
Sure.
So, but the interesting thing is then when I found my way to the way the combat sports community pumped me up, and
Awesome.
even all my social media and the name Fight Doctors friends did, like people pushed me to do it, and they've asked me to write a book a long time. And so I hope it, like I said, I hope it'll be published this year. It's got a lot in it,
Yeah.
women issues. The other thing for me too is I
Women
think
issues.
that, women issues, um, I think that like the single part in part comes from the fact that I think that, men die by suicide more than women, and
I didn't
so
know
many
that.
men cause this. And I'm sure you have a different perspective because
Sure.
the way your husband died is different. But I feel like so many men cause so much trauma for women, and so that's part of my story too. He picked me up by the jaw, threw me across the room like I thought he was going to kill me. And I just so there's to me, I being single is more important because I don't want what happened that night to label me, and make my identity. I don't want a man to cause that kind of trauma in my life and to do that to me and my family and then live in that forever. And I've forgiven him, and
Yeah.
but I think it speaks to men in society a lot, and the trauma that they cause us, so
Yeah. I like that. I love your transparency and your honesty about um the not so pretty parts of it. That is really difficult, has been difficult for me in how do I embrace the good, the bad, and the ugly and still remain the victim of being a widow. Well, you don't, you get to heal first, and then the other stuff, falls into place as it should. But that is truly right now. That's actually a focus for me right now is to get really okay with the good, the bad, and the ugly.
in
Acknowledge,
the person,
yeah.
yes,
And because I
yeah,
had no problem telling him he was an asshole when he was alive, why would I have a problem saying that today?
right,
So, I mean, and I don't mean that in disrespectfully at all, obviously. I just, telling, that's who we are as married people, you're acting this way. Stop doing that. That's
right,
after years of marriage, you're honest, you're transparent, are able
Right.
to say, don't do those things. Why can't I do that now that he's not here? That kind of thing. So
Mhm,
learning
mhm.
how to embrace the good, the bad, the ugly in non-judgment is
Yeah.
really it has become a focus for me. I think that's my layer of healing this year, if you will. Um,
Mhm.
so we are running out of time. I've got a little limit on, because I haven't upgraded my
Yeah,
phone yet.
sure. Yeah. Yeah.
But I want to reflect on just a couple of things that my biggest takeaways was, you talked about the shock. That's a big one. And you talked about, single is single. And that's a big one for me. And I will be journaling about these, by the way. I'll be writing about them and going, the shock. Wow. Changing time zones,
Yeah.
dude. What a great idea. Um, but I really I want to thank you for lending a different perspective to me. And and hopefully as I get better at this and I have better questions to ask and that kind of thing, I'd love to come back and revisit. But I do want to stay in touch with you, and thank you again just for
Yeah. Thank you for
being
having me. Thanks for having
so.
me.
Oh, you're welcome.
And the work that you do. I mean, it's great. It's great stuff. I mean, it's when I was first widowed, I was reaching out and looking for people who could show me that life was going to be okay again. And I think that's so important because I know it's one of the first things I started looking for.
One of I am, by the way, going to put your IG and that kind of thing. Who are you on Facebook? Because I know you on Instagram. I don't know you on Facebook.
So I don't really use
Okay.
Facebook for
Okay.
anything.
Good.
Um,
Good to know.
yeah,
Then
yeah.
we won't even address it. Yeah, I will. I'll
Started
make
a
sure that
TikTok. I just started a TikTok recently, but I'm not using it very much. I'm just studying it a little bit. So
it's a little
mostly,
overwhelming. There's a whole lot you can do.
I like, yeah, yeah,
Well, and then
yeah,
I think I'm gonna do something really cool on there, and then I'm just like, I just find
yeah,
myself doom scrolling.
yeah, right,
I can't.
yeah,
I'm like,
yeah.
I got to turn this off and go back to
They
something
know
that
how to
doesn't
snag your
consume
brain.
me.
Their algorithms know how to snag your brain, right? I mean,
In a
that's yeah.
heartbeat. In a
Mhm.
heartbeat. They
Yeah.
do. Indeed, indeed. So to anybody who's listening, everybody that's listening and watching, this is Andrea, Dr. Hill, and she is at Fight Doctress on Instagram. Who are you on TikTok in case somebody is
It's the same. Fight Doctress.
okay, cool.
Yeah.
And I'm trying to think anything else. Anything else you'd like to leave the watchers listening?
No, no, but thank you for having me. I
Oh, my
appreciate.
pleasure. Thank you
Yeah,
so
happy
much for making
anytime.
time for me while you're out of the country. I do
Yeah,
appreciate it.
no problem. Okay,
All right.
bye.
Peace, Andrea. Have a good one. Blessings.
You too.